I'm here with our neurosurgeon, Dr. Ibrahim. Alhamdulillah, he's been here for a long time and was the only neurosurgeon in Aleppo when he was besieged. We have this amazing item that was donated to the Doctors in Syria by One Nation. For everyone that doesn't know what this is a infrared scanner, and we're going to speak to Dr. Ibrahim about what this item is and why it is so important for us here in Syria. Assalamu alaikum. But why don't you start by telling us, what is this?
This is infrared scanner. This is the world's first device handheld. It's used for hematoma detection in head injured patients. This device is very light and very simple to use. It uses the infrared technology to detect brain hematomas before symptoms appear in the patient.
We can use this in places where we don't have access to a CT scan to detect if there's a bleeding in the brain.
Yeah, exactly. This device is used to triage patients, to detect patients who are at risk for brain hematoma.
So what does that allow you to do? Does that mean you can start doing surgery with this after checking if the person is
in remote equations where CT is not available, we can use this device to operate on patients who are on high suspect of having brain hematoma.
I think this goes well in hand with our projects that One Nation's launched of mobile hospitals. I think this will be quite handy for us doctors in mobile hospitals where we can move around and assess patients. What do you think?
Yeah, the device is very light and very simple to use. We can carry it everywhere where you go.
So, brothers and sisters, I just want to emphasize to you again, this is one of the only charities that's working so closely with us doctors in Syria. And you know, one thing I found with One Nation is whatever requests we make for equipment, they don't question, they just buy it for us because they trust our judgment as doctors here, saving lives on the front line. They trust the judgment to buy equipment. This particular item was...
You are the first doctors who use the device in Syria.
Exactly. There is not a second one here. So Dr. Omar will be the first one using this to save lives here. So what I would advise everyone to do, look, we're showing you again and again the aid that One Nation is purchasing for us, being used, coming to us. So this is one of the charities that we highly recommend you donate to. Wouldn't you agree, Dr. Omar?
Yes. Thank you for One Nation for donating this.
Yeah. So please continue to help us doctors here in Syria by donating at www.hospitalsinsyria.com. That's One Nation's fundraising page. Whatever money they raise through this link, they allow us doctors to choose which items we need the most. Like this infrared scanner, we are the first to be using this in Syria, if not in war zones like this.
For London's air ambulance, speed of diagnosis and treatment of trauma injuries is often the key to whether patients make a full recovery.
The near-infrared light comes out here, it's reflected off of here.
In spring, it began a year-long trial of this handheld brain scanner and has since used it on over 60 patients to help determine whether they needed urgent surgery to remove a blood clot. The handheld device uses harmless near-infrared light, like that in a TV remote control. The light beam penetrates the skull up to 3 centimeters. A blood clot absorbs light differently to normal brain tissue, and the signal is bounced back to the scanner. The whole procedure takes less than 2 minutes. A green light means normal, a red that a blood clot is present. In a hospital setting, it's proved 90% accurate, with patients then being given a more detailed CT scan to confirm the diagnosis.
On London's air ambulance, we treat approximately 5 critically ill patients a day, and the commonest causes of those injuries are road traffic accidents, falls from heights and assaults. And many of those patients have head injuries, brain injuries of some degree. So really, in all that population, this has potential to give us an earlier diagnosis and institute personalised, optimised treatments.
8 years ago, the BBC reported on trials of an earlier version of the infrascanner in India, and the device is now being used by the US Marines to detect battlefield head injuries.